Fine. So thank you so much for providing me for this great opportunity. So I would love to speak in this scenario. Moreover, so I am not a medical science basically person. So I am a basically social scientist, or you can say economist. Okay. So I will analyze the health scenario of India basically from the point of view of an economist. Okay. So there are a lot of things that medical doctors they can analyze from the health point of view, basically from medicine, from surgery. These things I will not talk basically. Basically, it is a different kind of things that I'll talk. Basically, it relates to equity, efficiency, finance, GDP, all these things, and comparisons with the developed countries, developing countries, how different healthcare system perform across the world, and how Indian healthcare system is performing. All these things I will discuss. So thank you so much. So let us start. So I'll start from the Mahatma Gandhi. As Mahatma Gandhi said, that health is basically a real wealth, and it's not a piece of, the real wealth is not a piece of gold or silver. It is health actually. So that means the health has utmost importance in our life. So if you see the World Health Organization definition of health, so health is basically a state of complete physical, mental, and social well-being, and not merely the absence of disease. So that shows that basically health has innumerable basically benefits and importance in our life. So this is an individualistic approach regarding health. So in addition to individualistic approach, there are also, if you say in the in terms of a country, health is also important for the country also, because a productive human being, a productive life expectancy can contribute for the social and economic development. If you see the population structure of India, India has a demographic dividend. What is demographic dividend? Basically, demographic dividend, India is consist of a population of young masses. If you add good health to these young masses, then our India's basically economy grow like anything, because these young masses will be highly productive and they will contribute to GDP. So let us discuss the healthcare expenditure in India. What actually government is basically doing in order to enhance the health of the country. I mean, health matlab all the health any of its citizen basically. So if you see the recent health accounts report, that is basically published by National Health Account Statistic, basically 2021 and 22, it was published. You can see that government is spending and out of pocket expenditure, I mean common man spending or public spending, if you take it together, so around 3.8% of the GDP actually we are spending in our health. So which includes government spending as well as out of pocket expenditure, that is people are spending. So out of that, basically we have mainly two things. We have one capital expenditure that is actually spent on the infrastructure, and another is current expenditure that is basically spent on the day-to-day health care systems. So it is capital expenditure is around 12%, and now you can see that it is also increasing. So these are very good things about our economy. So let us go gradually and see what is the picture of healthcare scenario in India. If you see the trend of total health expenditure, so it includes total health expenditure, THE here. Basically, it includes both government health expenditure as well as basically the public or people that they are spending. So togetherly, if you see, we have statistic from 2013-14 to 2021-22. So you can see that it is gradually in the initial year of 2013-14, it was 4%. And gradually it is declining in 2018-19, it is coming around to 3.2, 3.3, like that it is coming. And suddenly due to, you can see the last 2 years, 2021-22 and 2020-21, it is slightly increasing, because it is maybe due to COVID-19. Actually, that's during that time actually government spend a lot. So if you see, if you basically break these two expenditure, as I told that previous slide, it is total health expenditure. If you break this, so you get two things: out of pocket expenditure. Out of pocket expenditure is basically spent by the common people, and the government health expenditure, that is spent by basically the government. So if you see the trend is like from 2013-14, publics are spending more until 2020-21. You can see the green line actually out of pocket expenditure, that is the common people are spending. So in 2013-14, the common people are spending around 64% of the healthcare expenditure as a percentage of total health expenditure, and that graph is gradually declining, but still it is higher than government spending. That means people are spending more compared to the government. It is until 2020-21 where actually government spending increased compared to the people spending. That is 48% in 2021-22. That may be due to emergence of COVID. The recent data, if will come, then we can see the real picture. So here, up to 2020-21, the people are spending more compared to the government. So let us see as a percentage of GDP. Okay, total healthcare expenditure, if you divide into two parts, out of pocket expenditure and GH means basically general government health expenditure. OOP basically out of pocket expenditure. So if you see the out of pocket expenditure, again I'm speaking, that is basically common people are spending. That percent as a percentage of GDP, that is 2.43% in 2014-15, and gradually it is declining. That's a good sign that people are spending less, government is spending more. So the government spending is also increased from 1.1% to somehow in 2020-21 it increased to 1.84%. 21-22, sorry, 21-22 it increased to 1.8%. But up to 2020-21, still the out of pocket expenditure was higher than the government. So this shows a very good picture actually, that okay, fine. So over the decade, we can see that government spending in health basically increasing, right? So government spending in terms of as a percentage of GDP, or you can say in total or absolute term, whatever you say, in media or newspaper, you can also see that okay, the government of India is spending over the decade higher and higher amount of health expenditure. That's fine, that's good. But so this is a kind of things that we are not comparing with anyone. We are just taking India as a case. So we can say that it is gradually increasing day by day in over the decades. So let us compare with our percentage of spending basically with our neighboring countries. Okay, so here this figure 4 actually speak about the government general health expenditure basically as a percentage of GDP in compared to our neighboring countries. Neighboring countries, you can see India start at 1.29%. If our GDP is 100 rupees, only 1.29 rupees India is spending on health expenditure. So if you compare with our other neighboring countries like Nepal, it is spending almost double than India, 2.11%. Even Sri Lanka is higher than India. You can see China, 2.95%. Forget about Maldives, that's an exceptional case. So almost China, then Nepal, then Sri Lanka, around 2 and 3 times they're spending more than the India. So this is the picture about our neighbors. Let us go to the big picture, because India is aspiring to be a developed countries. So we are saying we have basically high GDP growth. We are the third largest GDP in the world in terms of GDP or PPP, mean purchasing power parity. In terms of nominal GDP, we are basically 5th largest economy in the world. So basically we are a very growing economy. So let us compare us with the developed countries, those who are very growing economy. Let us compare with them. So this figure 5 actually compares India's government health expenditure as a percentage of basically developed countries. And that means how the developed countries government are spending and how the Indian government is spending. So the Indian government is spending around 1.29% of the GDP, whereas the developed countries like Germany is spending around 10%, then Finland is spending 7.89%, USA is spending around 9%, then Canada is spending 8%, Australia is 7.3%. So this shows that the developed countries are huge. They are investing hugely in health. So that's why basically they are developed, because their investment in health is more compared to India. So if India want to be developed, then it has to invest more in healthcare system. Although India's investment in healthcare is increasing, but in comparison to our neighbor as well as the developed countries, it's quite low. If you compare with Canada, if you compare with Germany, it is almost 8 to 10 times more they are spending. Okay, so even Switzerland, also small country, they are also spending huge, almost 4 times. So let us, you will say, sir, okay, also government spending is less, you are telling, but our GDP is very high. So as a percentage of GDP, economic person, some will say that our GDP is 3 point some trillion dollars. So it is a huge GDP. Even you spend 1.29%, so it will be huge money that we are spending, right? In comparison to the small countries, they're spending 4%, 5% of their GDP basically. So let us don't compare this GDP and all this figure. Let us come to the real picture. Okay, you see the real picture that if the government is spending, there must be hospitals, that must be doctors, there must be beds. So figure 6 basically speaks about hospital beds per 10,000 population. So how much Indian government actually in India basically have hospital beds in comparison to the neighboring countries? Okay, you can say India have around, you can say 16 bed per 10,000 population. So here you can compare with India with Sri Lanka. You can compare with China, the neighboring countries. They have around 50, 40 beds per 10,000 population. So in this sector also, India is lacking. Though India is spending, I mean, as a percentage of GDP, it is spending less. In terms of hospital beds also, it's lagging behind. So if you compare this figure with basically the developed countries, those are like Japan, Republic of Korea, Singapore. This is huge. Germany have 78 bed per 10,000 population. Japan has 127 beds. And these statistics that I am not speaking all these statistics. Whatever statistic I have presented here, I have taken from government websites. Like the previous statistic that I have presented, that is from National Health Accounts, that is published by Ministry of Family and Health Welfare, Government of India. And the current statistic that I am comparing with the other countries, that is given by World Health Organization. I am not telling any statistic. These statistics are already established statistics. So basically here actually this shows that still in terms of hospital beds also we are lacking. We say that Indian doctors are very good. That's right, that's true. But do you know how much doctor we have per 1,000 population? For 10,000 population. Here you can see figure 8. India have around 7.23 doctor per 10,000 population. World Health Organization, they are saying that India has 7.23 doctors. Whereas in comparison to, you can see the comparison to Nepal has more, 10 doctors. Even Sri Lanka and Pakistan also going high. Forget about Maldives. Maldives is quite high. So this is the basically 10,000 population doctor in case of our neighboring country. So let us aspire big. We compare it with the developed countries. To developed country, can you see the picture? India is 7.23, whereas Germany is 45.34 doctors. Norway is 49.75 doctors. Qatar is 30.22 doctors. All are higher than India. So we need to think about this aspect, that whether the government spending should increase or more. So in this respect, actually, let us compare our healthcare system, healthcare insurance with other developed countries. Okay, if you want to develop, then we must invest in health. So we should see how the healthcare system in other countries are functioning, and how basically in our country how healthcare system or health insurance is functioning. If you see India, I think our learned doctor, they know more than me in this respect, because Indian healthcare system they are dealing with every day. So I just read some paper and I have presented all these things. So just to recap, Indian healthcare system have basically mixed kind of structure, basically public payer and private, basically government and private hospital and corporate hospital, they are operating. If you see insurance is also provided by private as well as government insurance agency. Total insurance in our healthcare system is around 5%. 5% expenditure is in our healthcare system is basically coming from insurance. Whereas if you see Canada has a universal healthcare system. Actually, Canada, the government actually funds all the insurance, I mean all the healthcare expenditure to its citizens. So whereas in USA, the system is different. USA is a capitalist country. USA actually depends highly on private healthcare system. Government healthcare system is not much active in USA. So basically, private healthcare system, insurance is also made by the private, because these are capitalist country and their per capita income is quite higher than India. So they can bear it. Moreover, US is also providing some kind of insurance like Medicare to its senior citizens who are above 65 years old. So US kind of capitalist system where private healthcare system is very active, and the government is although taking care of its senior citizen and the very poor people, but still it's not I mean, that much government is not active in healthcare system. So UK healthcare system, you can see that's called sometime back. It is called the best healthcare system because they have NHS, National Health Service. So National Health Service is basically publicly funded healthcare system. So they actually provide all the healthcare expenditure actually spent by the government. So these are the healthcare system in different countries. So here question arises. In India, who should own the healthcare system? Is it government or private? Whatever I presented, that is just a data. Okay, so there is nothing economist in there basically. That's in order to know that basically this is the system and how this is the position of India. So now before actually taking any kinds of basically any kinds of opinion, so I just show you that this is the situation of India. So before making any kind of opinion from an economist point of view, so we know that India stands where in the global forum, India stands where in South Asia or Asia, or in terms of, even if you see GDP, sorry, healthcare expenditure as a percent of GDP, you can see India where actually exactly stands. After understanding all these facts, now we can ask a question: who should own the healthcare system in India? Is it government? Is it private? So here actually the interesting economic theory comes to existence. Healthcare, if you see, healthcare actually is a service, or you may say goods also. Sometimes goods or sometimes service, healthcare system. Basically, healthcare system provides goods or services to the people. Okay, so that is very simple. Like other commodities, you go to market, you buy goods or services, right? So in economics, any kind of goods and services, actually basically market should supply. Market means it's not government. Market means anyone can supply. It may be government, it may be private, anyone can supply goods and services. And the very interesting things, how the prices of goods and services is determined. In normal goods, in any case, suppose you go to market and you want to buy vegetables. So suppose you want to buy tomato. How the tomato price is determined? Basically, the demand for the tomato and the supply of the tomato. The demand and supply of tomato actually determine the price. So take another example. How the suppose you want to buy a car. How the car price is basically determined? Any car. Suppose you want to buy a Skoda, you want to buy Audi, whatever maybe car you want to buy. So how the basically price and basically price of the car is determined? So it is a demand and supply interaction. If demand and supply must meet each other. So there is a basic principles in economics. If the demand is high, the price will increase. In the market, if the demand is high, if tomato demand is high, the price will increase. If a certain car demand is high, its price will increase. And vice versa. If you see in case of supply, if supply is high, then price will decrease. If the farmer will produce more tomato, what will happen? The price will reduce. So if the car company will produce more car given or constant the demand, so what will happen? The car price will decrease. So here actually this is the market actually basically. Market operate like this. Market operate actually demand and supply. So healthcare is also a good or a service, you can say. So if you take at a marketed commodity, what will happen here in case of healthcare? What happened? Market actually fails to operate. Why market fails to operate? Market cannot provide socially optimal output. Exactly the output what actually society needs, the market cannot provide. That is one thing. Another thing, on the other hand, actually, the market in healthcare market, if you include, if you both the private and government player will be there, then what will happen basically? The socially optimal output will be not produced. That is one thing. Second thing is induced demand may be created. Induced demand means basically in healthcare, what happens? So sometimes induced demand is created. Why induced demand is created? Induced demand is basically my demand. I demand tomato because I need it. I know it. I want to buy it. So I am demanding the tomato. That is basically real demand. What is induced demand? You may not need it. You don't know that you need it. But so demand will be created once you will go to the hospital. So here the most very beautiful economic theory will come to existence. That is information asymmetry. Information asymmetry means, so it is just opposite of information symmetry. Information asymmetry means if you are buying any product, you don't know about the product. That is information asymmetry. But in case of normal good, if you want to buy a car, you know about the car. Before going to buying the car, you make a search about the car. You want to know that what feature I need. I need automatic, or I need gear kind of car, or I need side mirror automatic or manual. So these features you know before going to, because you have information symmetry, you have perfect information. However, in healthcare, basically health as a good or service, there is information asymmetry. What information asymmetry basically? Basically, you don't know about your status of health, because welfare economics says that healthcare is marked by profound uncertainty. Illness occur basically unpredictably. You don't know when you will be ill. You don't know when you will demand. And the effectiveness of the treatment is often uncertain. You don't know what is the treatment. Basically, you are the demand side. Basically, you are acting from the demand side, but you don't know your demand. Getting my point? Basically, although you are demanding goods or you are demanding healthcare, but you don't know the demand. So who actually inform you the demand? The healthcare provider, basically. Who is the healthcare provider? They actually inform you the demand. That means there is a significant information gap between the healthcare provider and the patients. That means this asymmetry information can lead to suboptimal decisions sometimes, where the patient may not able to accurately judge the necessity of the treatment, while healthcare provider might induce the demand, might create artificial demand in the market. Although in the market there is no need of certain kind of surgery, but the healthcare provider can create demand for that kind of surgery. Getting? So what will happen? The artificial demand will be created. If there is artificial demand in the market, what will happen? Basically, the prices of healthcare will suddenly increase. The prices of healthcare will increase because there is a huge demand for that certain kind of things, and that is created by the healthcare providers or in the market. Basically, market is creating artificial demand. So the basically the consumer, the basically those who are buyers, they are not demanding. Actually demand is created by the market. So this thing, what happened, that actually create asymmetry information, and that actually rose the prices in the market. So here actually market fails. If you don't have price, you don't have money, then you cannot get that services. If there is both the players, government and private players operating in the same market. So this happens in many cases. You can see the health statistic data I have not put here. Suddenly you can see the C-section surgery is increasing in India. You can go and see that data. So quite last 10 years it is increasing very highly. So previously it was not that much, but now currently it is increasing due to induced demand, artificial demand in the market. Then here question arises, this is a market, basically health is such a good or service where actually market fails to provide the optimal output. That means government should spend more in health. Government should enter into the health. Government should not make the healthcare system completely private. If the government will make completely private, what will happen? Then market failure will happen. So government intervention should require in healthcare system, right? But here question arises, why the government will interfere? What is the basically need of the government to interfere in the healthcare system? If you see, India is a democratic country and India is a welfare country. What is the aim of the welfare? Basically, aim of the welfare means basically the government wants the people should be first live a healthy life. Then second, they should be educated also. So why this actually required? Because healthcare, if you see, healthcare has a positive externality. Like pollution have a negative externality. If your city has more pollution, then you will get affected by disease. Similarly, if you have good people surrounding by you, so what happens? So your health will be also good. That's why actually government promote vaccination program with its own cost. During COVID time, you can know, because if someone is affected by COVID, then it is a danger to you. If you are healthy, that's not fine. If your neighbor, if your driver, if your cook, if your office attendant, he is healthy, then only you can be healthy. So that's why healthcare or healthcare goods is called merit goods. It has merit basically. Because it has positive externality. If someone is healthy, then that will also affect to you. It may be mentally or physically, whatever may be. So that means So it will, if you take collaboratively, so all the people are healthy means it will improve the individual productivity and indirectly improve our GDP. If the productivity improves, so the GDP will improve. So here question arises. Government is shifting towards basically insurance model. So here question arises, sometimes insurance models are not good, not always good. Why it's not good? Two problems are there in insurance model. One is moral hazard, another is adverse selection. These two are a very economic concept. So moral hazard basically occurs when you basically purchase the insurance, and after purchasing insurance you behave irrationally. Why? You think that my health is secure. Why? Basically because I have basically purchased insurance. If anything happen, then insurance will take care of me. So this actually put suboptimal output and extra burden on the government or the insurance provider. Insurance provider may be government or maybe private. So it will put another burden. The another thing is adverse selection. Sometimes people also basically, they also, due to asymmetric information, they actually purchase the wrong insurance product. So during the time of hospitalization, they cannot use it. So here, welfare economics actually concerned about this. That say they actually say that insurance always cannot produce the optimal level of output. Then another question is coming. So people will say that, okay, private healthcare system is more efficient. That's okay. That's right. That's true also. On the other hand, government healthcare system is more equitable. Equitable means it is accessible to all. Despite of poor, rich, despite of any caste, color, creed, anyone come to government hospital. Equitable. It is equitable. However, government hospital is basically nowadays is not efficient as compared to private hospital. I'm comparing basically. I'm not telling basically that absolute term that government is not efficient. Some government hospitals are efficient also, like AIMS and all. But I'm comparing with the private. So in comparison to the private corporate hospital, basically they are very efficient. Efficiency is very high, but they are not equitable. So here actually concept actually trade-off comes. Whether you want efficiency or you want equity. What should you do? If you see, social health is a function of social welfare. Basically, health actually produces social welfare. What actually produces health? Basically, welfare of the society. Because if individual will be well off, then society will be well off. So here, policy makers has to think, has to prioritize basically which kind of healthcare they want to go for. It is completely, they want efficiency, then private is better. If they want equity, then government is better. So here there is a trade-off. So which kind of healthcare model the government of India or government of Odisha should adopt here, basically in order to get the maximum output, basically. Maximum output means here the social welfare. So these trade-off government has to think. So here, so you will say, so you only say the problems. So these are the things, these are the things. So always shouting about the problems are not good, right? So because we always think about the solutions. So I have few solutions. So what are the solutions for these things? Because you're telling that government should spend more in healthcare. Again, you are telling that government healthcare system is not efficient, although it is equitable. On the other hand, you are saying private healthcare system is efficient, but it is not equitable. So what kind of model the government should include? So is the government will make all the hospital privatized, or the government will make all the hospitals nationalized? Like nationalization of bank happened in 1969, right? So government will make all the private hospital nationalized. So actually the solution lies in middle path. Okay, so there will be private hospital, but there will be government hospital as well. Both the players will play simultaneously. But government hospitals should focus on basically efficiency and increasing how the efficiency will bring, how the efficiency system will basically bring to how the hygiene, how the high technology machine, how more number of doctors, more number of nurses, they should come to government hospital, right? Then only the government hospital can be efficient, right? Because private, they have hygiene, they have enough number of doctors, they have enough number of nurses, then healthcare facility, all the things are available. So how the government hospital will be efficient? By spending more and more. Still now also our health spending is less than 2%. Government expenditure on health, you see lower than, less than 2% in compared to developed countries. It is almost 5-6 times more. So government has to spend more on healthcare so that the government hospital can be efficient. On the other hand, private hospitals are already efficient. So how basically you make them more equitable? Because private hospitals, they apply the principles of exclusion. Principles of exclusion means if the healthcare is basically a universal product, right? Everyone should access it. And in government healthcare system, it is right, anyone can access the healthcare. But in case of private, it is actually principles of exclusion is applied. It is not accessible to all. So basically, healthcare is a welfare commodity, welfare good or welfare support. So welfare basically product. So private healthcare system is basically guided by profit, balance it. If it is not profit, then balance it. Some people will say no, hospital is not run by profit. Then the balance sheet is there. There must be, I mean, cost must be equal to basically income. So balance sheet is there. So here basically we have to make the private hospital more equitable and non-for-profit. How to do this? So then those who are private or corporate player, then they will say, who will fund this healthcare system? You are telling that it will make more equitable and non-for-profit. Then who will fund this? So two things can be happen basically. So first thing is that there is extremely high prices in the private healthcare system. So government should put caps or price ceiling on the private healthcare system. Suppose ultrasound cost actually varies in different private healthcare system. One corporate hospital charging same ultrasound 2,000 or 3,000 rupees. Normal private hospital charging 1,200, 1,300 rupees. Similar government hospital it is free. If you do in SCB, it is free. Or AIMS, it is somehow 200 rupees or something they will charge. Very nominal. Yes. So here actually there is no price cap. The same product, how they are selling in different prices. Product is same. They are not providing any extra product. So here actually the government should put the price ceiling. This much actually you can sell the product, that ultrasound or whatever maybe you have, that you can sell at this price. Then the private body will ask question. The corporate will ask question that how to fund then our healthcare. We have world-class efficient healthcare system. We need money, otherwise you cannot run it. So here actually I will provide one solution, CSR. One fund is there in every company, CSR, corporate social responsibility fund, basically they have. Private hospital can basically suppose MCL, it has a huge income, they can actually fund one hospital. So that private hospital, so that the people can get subsidized price. So this CSR fund can be also utilized. Moreover, there are other ways also. Private hospital also go for donation, then they can also go for government projects. All these things they can go for in order to actually sustain their financing system of their healthcare and maintaining efficiency, as well as including the people actually making it more equitable. So if this thing will be happen, then I think the healthcare system will improve more in India, and we can compete with the basically the with the developed countries basically. So then we can actually the vision of Vikasit Bharat by 2047 can be achieved. Without investing in health, we cannot achieve the vision of Vikasit Bharat. So that we can achieve. That's a very clear-cut idea that I can pose here. So